It's our first device damage now in this procedure. Good morning, everyone. I want to thank you for, and also thank Professor Michal, Dr. Nazih, and everyone in the Saudi FDA for giving WHO the opportunity to be here and to present this experience that we consider is a model for many countries to follow. The procedure upon which the medical device program has been implemented into the Saudi FDA is really something that we look forward to and we cherish. And our countries are here as well to see this experience, to witness it, and at the very end try to apply the model with the experience they gained from the Saudi in order to advance this area in their settings. What I'm going to present today for all of you is the actual situation of the medical device regulation in our part of the world. And I want you from the start to excuse me for including some basic slides for some of you, because as we said, we have countries at different stages. So some of them usually at the very first stage, so they need to know a little bit about regulation. And then we go forward with countries at the stage of development where they would benefit from this, using our experts to advance, because there's always room for improvement. Let me start by saying that my presentation will be divided into four main parts. The first one is just to introduce the topic very quickly, then go into general concepts, including what's the difference between medical device and medicine regulation. And I understand that many of the policy and decision makers in our parts of the world taking care of this area are usually pharmacy graduates, and that's logic, because the medicine regulation is much more advanced, and these are the head of national regulatory authority, like Professor Meshal, and so on. So they need to know what's the difference in a nutshell very quickly. Then we go into what's the regional situation. And it will be a reading of the global survey that Martha mentioned and was conducted in headquarters, and Jose is sitting here. She was in charge of that. We'll highlight the part that concerns us, our region, how it is doing, and then the future steps. Let me go to the introduction very quickly and say that we are working in a field where there is about 1.5 million devices circulating in our markets. And all of you know now that it's impossible for any physician to conduct his work, or a hospital to be there, without the proper medical devices. And by medical devices, we mean equipment, supplies, and instruments. So it's not only, you don't think of a CT and MRI only, but the device also include supplies like cotton, tongue depressors, swabs, buds, and surgical instruments used in operation theaters and used by physicians. And so therefore we have many product types, and there are over 1,000 product groups, which covers maybe 50 clinical specialties. But it's broadly classified into something to diagnose with and something to treat with. So it's diagnostic and therapeutic devices. This is a broad classification of what we're talking at. And those are some examples of all diagnostic like CT, MRI, X-rays, and so on, and therapeutic like, implantable used in operation theaters, and many of the devices that you see hovering around. The thing is that we import most of those devices because the global market is usually controlled by Europe, Japan, and the US. Those are the three main players. They control from 65 to 70% of the markets. So we are importers of those medical devices. So regulation is important to put the right standard for you to control what's entering your market. And those figures are from the world market in 2008. The market size itself is around $300 billion. So it's a big market. And not as big as the medicines, but it's a big market. We expect from the device that we import to be safe, effective, affordable, accessible, appropriate, available to our population, and of course high in quality. And the first step to ensure that is through regulation. So you cannot do all of these, you cannot achieve that from your devices without regulation. So what are the general concepts now of this regulation? Actually, as you see, and as I illustrated in the previous slides, there's a huge diversity. There's thousands of products. So how can you regulate those devices? The logic is that has been followed is that we will take it from the risk part. We will see the risk of each device, and based on that, we will do the regulation. However, absolute safety can never be guaranteed. But risk management is the key to regulating those medical devices. And therefore, regulation should also be somehow aligned with the effectiveness and performance of the device. But bear in mind that it's not only the regulator's responsibility, it's all the stakeholders' responsibility. Manufacturers, regulators, even consumers and users have a shared responsibility in this. So, based on the risk, the Global Harmonization Task Force, now it's called IMDRF, is putting 4 classes of devices to be that we can regulate with. The lowest is the low, and therefore we have a low-risk devices, and then low-moderate, and then moderate-high, and then high-risk devices. Class 1, 2A, 2B, and 3. And if you look at the last column, at the last row, I mean, the heart valves, the implantables, the defibrillators, the stents, they're all used mostly inside the body. And therefore, it goes without saying that these should be of the highest regulation possible, because it's going to be used inside the human body. And then the regulation is relaxed until we reach, minimum set of regulations for low. And therefore, between the relationship between the regulation and the risk should be directly proportional. Low risk have low regulatory requirements. Highest risk has the highest regulatory requirements. But are these requirements really look like the ones for medicine? So if they look like them, why should we have a different program on medical device? No, they don't. Because of several reasons. Because actually medical devices is different from medicine's regulations. Why? Medical devices involve a great deal of and a great variety of scientific disciplines. They involve engineering, sometimes material science, sometimes nuclear and radiation, like the equipments used for cancer treatment, sometimes biological sciences, some even of the devices have drugs inside them, and so on. So therefore, they're quite different in having variety of disciplines. 2, devices have shorter life cycles than medicines, maybe 5 to 20 years, and a new technology comes with a new device. However, I have seen some medicines, and my mother was a pharmacist, by the way, and I used to assist her in the pharmacy. I still remember names of products when I was a child that when I enter the pharmacy right now are still there. So medicines can stay for a longer period, but devices usually have shorter life cycles. And there are several things ongoing together for a device to work: electrical, mechanical, and many other disciplines. And because of this reason, the devices can fail due to many reasons. They can fail mechanically, they can fail electrically, they can fail, the software can be damaged, and so on. So we have, as a regulator, to ensure the functionality by ensuring all of these and having something to say about all of these things. And also, which is very peculiar, that they might fail after so many years for reasons not known from the start. So therefore, continuous regulation, continuous monitoring of the market, and picking up those adverse events are important for manufacturers as well, and important for the public. So regulation is different. And the stages of regulatory control, and I'm not going to dwell on that slide, but you have to know there are things that you have to do before it enters your market, which is the pre-market controls. There are things that you have to do as a regulator. You put some regulatory controls on the market, like controlling advertisement, listing of manufacturers, listing of and the classification of devices, having a database of what's inside your country, so on. And then afterwards, after you give permission for the sale of those devices in the post-market part, which should be also continuous monitoring of the performance of the device in your market, which can be very important, as I said, because it can fail due to other reasons. So post-market is also an activity that you should do. This is a recent MRO-seeing of how the stages and how the controls. I'm not going to dwell on that slide, but all what it says that there are many regulatory functions that you have to follow over the life cycle of the product, from the inception and design up to the waste disposal. And in some jurisdictions, like Malaysia, for example, waste disposal, how to get rid of the device, is included in the regulation. However, there are others, in like many countries that I've seen, the getting rid of the device is the responsibility of the Ministry of Environment. So this even is debatable. Whose responsibility when you get rid of the device? Anyway, what's the conditions and what is the medical device conditions in our part of the world, in our region? Martha have highlighted that many national regulatory authorities focus on regulation of medicine, and this part is often overlooked. And even if there is a medical device regulation in some jurisdictions in our parts of the world, they are usually handled by non-specialists, meaning pharmacists, people that have no backgrounds on this. And therefore, effectiveness in quality management systems, QMS and others are not there. And also, many of the jurisdictions are only effective in monitoring public entities, public hospitals, but they're not effective in monitoring the private sector as well. As she said, many of our regulations are outdated. There's a high percentage of population who lacks regular access to quality. How many times we've seen products, and I'm not picking on some Asian countries, that are coming of low quality and they cause damages and errors, and it's on the news and everything. Therefore, we have to be from the start very, of course, as we said, many are imported. Misuse is a problem, and having a low quality device can lead also to pure procurement practices at the Ministry of Health level as well, if you allow it to enter the market. I was just talking to my friends there that sometimes low quality medical devices, if they are allowed to the market, are competing against good quality, which of course of a higher price, and taking sometimes the bids from good manufacturers, good quality products, and this hurts our economy. Anyway, let me show you what's the status for those alarming numbers that I was really shocked when I saw. First, this, as I said, has been done by headquarters. I picked only the part that belongs to us, the 22 countries of the region. And I've grouped them into, with the same grouping that Martha mentioned, Group 1, low income, Group 2, middle income, and Group 3, which is the high income countries, Oman, Saudi Arabia, Qatar, Kuwait, and so on. And we ask key questions. First, do you have a legal framework? Is there something in the national health policy that says that you have to regulate medical devices? As you can see, authorizing legislation is found at least in 50% in each category. So there is somehow a regulation that says this. Okay, do you all have a national regulatory authority? Not necessarily doing devices only, but do you have one that looks into the safety and efficacy of medical products? Almost all of them have middle and high and low income countries. Now, we go into the key questions for the medical device regulation. Do you have a definition of what's a medical device? 33% of the low income countries only has, and the others don't. 50% in the middle, and even in the high income countries, it was a shock to us to find that only 40% of them has a legal definition of a medical device. And the legal definition is already there by the Global Harmonization Task Force, is already available. Okay, second thing, do you have a nomenclature system, like a code? When you go to a supermarket, you buy something, there's always a code. And this code helps you create databases, listing of devices, classifications. Only maximum is 50% of the countries, they have that code. The others, less than 50. And by nomenclature, we have two major systems, what's called the Universal Medical Device Nomenclature System, the GMDN, Global Medical Device, or you can create your own as a national developed. So do you have a national database, a barcode, a code for every device? The answer is, the response is weak. Risk classification, as you can see, as the 4 steps that I mentioned in previous slides, low to high, only small numbers of them adopt that risk classification international measure. Reliance, do you rely on other jurisdictions? Because sometimes you don't have the function. You can rely on other FDA, CE. How many do you rely? Those are the percentages. Labeling, do you have specific requirements for the label that any product that comes into your market? Mostly high-income countries, mostly low-income countries said yes, although without that, but These are the figures. And I can go on and on. I don't want to waste your time. On the market, advertisement, listing, import controls, advertisement. We go into the key functions for every step, and we found that the response. By the way, in the high income column, mostly Saudi Arabia are the ones contributing to the percentage, and that's why we're here. For the others to see why and to benefit from that experience. If we go to the post-market, do you have a market surveillance mechanism to monitor your products, quality management system inspections, post-market enforcement, meaning that your regulators go and pull the devices that are of low quality or that has caused some damage or risk. Adverse event reporting, is it mandatory? If someone went to the hospital and the machine caused severe damage to something or death, do you report that as a hospital? Do you have something that says this? And so on. And the figures for post-market is really low, extremely low, meaning that this is not a normal activity. Membership even to international organizations. Only I think Saudi Arabia is a member of the Global Harmonization Task Force. Asia Harmonization Working Party, we have others from Asia as well. But the membership is low. And becoming a member, meaning I can harmonize my regulations, and adopt from other countries to have a unified. It makes it easier for the manufacturer. So if you're a manufacturer and Saudi Arabia accepts you and accepts your product, meaning you can sell it in other jurisdiction countries that recognize your standards, and therefore becomes easier even for the industry. So, my dear colleagues and participants, figures are alarming, and that's why we're here. We're not holding this meeting here to just enjoy the hospitality and the generosity of the Saudis. No, we're also hosting it for you to benefit from our presence, to benefit from the Saudi experience, and to boost those figures up. We have to do something about them. We have a real problem in the region. And to address that problem, as Martha said, there was a document in 2013 that said regulation is important to health system strengthening. You cannot have a good health system in your country without regulation, which will affect your access to good products, which will affect the indicators for health system performance. We also have conducted a pilot study, and Alan was with me in 2 countries, of them at least. Alan also was the main contributor to a guide that you will see, as Martha mentioned, and this guide is part of our effort to promote this area. We have also developed a unified tool to assess NRA, and this tool has been developed in EMRO. We have another tool to assess your performance, which is developed by a headquarters. It's called NRA Assessment Tool. In that tool, the assessors will come and ask you, what are your indicators for medicines, vaccines, and devices? And the devices part will be included very shortly in that tool. So therefore, if you don't have a good program on devices, you will not be recognized as a stringent regulatory authority anymore. Because as we said, products regulation should be in its entirety. Also, we consult with different experts and networks. And with this consultation, we hope that we also can provide you the good advice and the capacity to build your program forward. Thank you so much.